All right, so hi guys. I hope that you guys are doing pretty well. So today it's gonna be the second episode of the Let's Start series that I started like 3 days ago, and today I'm gonna talk about the kind of extracurricular activities I'm involved in right now as a pre-medical student, and other kind of activities that you guys might can do in order to fulfill this requirement, which is you getting clinical experience or you getting patient care experience. So the thing that I'm currently doing right now is scribing. So I'm a medical scribe for those who didn't know. So my job is pretty much like help the doctor when I can or when I'm allowed to by taking good notes, good history, good story with what the patient is saying. That's pretty much what I'm doing. And also make sure that I note every single thing that the doctor says and things that are relevant to what is being discussed, which is how the patient is feeling, what kind of medication has been prescribed, what kind of surgical procedure that the patient already had, and what the doctor will do following up the consult. So that's pretty much what I do on a daily basis. Not technically on a daily basis because I don't go to work every day, but that's what I do on a weekly basis. That's so much more better. Even if you can think, no, I'm not gonna even talk about that. And so you guys don't necessarily need to go and become a medical scribe in order to get clinical experience, because there is a good amount of way that you can actually um use, and maybe a good amount of path that you can actually use so that you can get your clinical experience that you need. So one way that some people or most people around me actually use is the path to becoming a medical assistant. So the most people that have around me pre-medical student, the thing that they choose to do is become a medical assistant. So their job is kind of like the same thing as me, but they sometimes do more than me, like stuff that I'm not allowed to, such as take blood pressure, maybe take weight of the patient and stuff like that. So I'm not allowed to do that on the practice where I'm work at. But I think like the amount of things that they allow you to do is based on the practice where you currently work at. So I'm a medical scribe. The nurse and maybe the medical assistant will do all this kind of stuff that I just talked about, such as check the pulse, take weight if necessary, and do other stuff. But like my job is to note every single thing that they've done if they didn't put it on the patient chart. So you can go ahead and become a medical assistant, which pretty much has the same workload, but it can be a little bit heavy than the medical scribe because scribes are not always needed, but where I work at they are. So you can have a pretty light schedule as a medical scribe and a pretty heavy schedule as a medical assistant. But it's also again based on where you work at, what kind of practice that you work at, and what kind of specialty it is. So you have medical scribe, so you can become a medical scribe. You can also go and become a medical assistant. I already talked about it. And you can also go and become an EMT or paramedic. So this path, I don't really know anything about it because I don't personally know anybody that choose it as a path to get clinical experience. But based on my understanding and maybe stuff that I've been able to understand by myself by looking at other people that actually went through the same path and talking about it themselves, is that you need to go to some kind of class, some kind of program, and it's pretty lengthy actually. So I don't quote me on this, but I think you kind of like need more than 2 months to get certified and to become a paramedic. So it's a pretty really long process as a medical student, because you have to study for your classes and you also have other kind of responsibility that you need to fulfill on a daily basis. So taking such responsibility, knowing that you have all the stuff to do, is really heavy based on what you're doing right now. So that's why I didn't choose to go and become a paramedic, because I'm doing way too much thing on a daily basis to actually go and become a paramedic. I'm not saying that that you shouldn't go and become a paramedic if you want to, but the thing that I'm trying to say is it will take a good amount of time for you to actually get to this path. And if you really want to go and do it, go ahead and talk to people that are currently doing it and make a choice. So nobody gonna do it for you. So you can actually go and become an EMT, and you can also go and become a CNA. First of all, when I was thinking about getting clinical experience, the first thing that I was thinking about is become a CNA, because for me it was way much more easier. Even though most of the people that are actually CNAs that I know, they went to like a program, would be some kind of classes that they had to follow before they get certified. But I personally choose to not do the class and study by myself, because yeah, I thought I was about to be way much more efficient, and I really didn't have time to dedicate to stuff other than my classes and other responsibility that I had at the time. So that's why I choose to study for it. But the reason why I changed my mind about becoming a CNA is because I've, so, what was the reason why? One day I was talking to one of my friends, and she talked to me about becoming a medical scribe, and I don't know, but the idea of becoming a medical scribe sounded way much more appealing back then than become a CNA, because of how CNAs are treated where around my area where I lived at, and also one of the stuff that I'm not ready to talk about in this video right now. So that's why I said no to become a CNA, but I still study for the exam, because I tell myself that the knowledge that they kind of have when it comes to patient care, I can actually start learning about it and keep it somewhere in my mind when I will actually make use of it, because I will obviously make use of it. But yeah, the vocabulary words and the keywords that I use, that I learned while training for the exam, I surely did use them as a medical scribe, so it was not a waste of time at all. And I'm pretty sure that I might change my mind, like maybe 1 year, maybe 2 years, once I will get my AA and move out of state to get my bachelor, because I just think that becoming a CNA will be a better option for me once I'll be leaving Miami. But right now I'm in Miami, it's really not a best option, so I'm staying as a medical scribe. So yeah, you can go and become a CNA, or some people do what's the name of this thing again? Behavioral some kind of thing, therapy. So it's pretty much the same thing as becoming a EMT when it comes to classes. I'm not telling you that the path is the same, but you actually need to enroll to a program and take some classes harder to get certified. So it's pretty much the same thing that you will have to go through. But I also did that about it, but I ended up not going for it, because again, you have to take classes, more responsibilities, and I already have stuff that I was doing on the side, and I was really not ready to actually put more responsibilities on top of those I already have right now. So that's why I didn't choose it as a path to get my clinical experience. But it's definitely something that you should consider if you are into direct patient care, or you want to do something that is not CNA related or EMT related. I don't know if you kind of like find things on what I'm saying right now. So lucky you're smart. But yeah, I'm gonna summarize the video right now, because I think I already gave you guys the options that I really wanted to talk about, which is first of all become a medical scribe, or become a CNA, a EMT, or the therapies that I talk about. So you just need to make sure that you are fully okay with the program that you choose, because it's going to be an investment and also a responsibility for you that you'll also need to fulfill. And you also need to make sure that the clinical experience that you choose, you'll be able to stick to it, because at the end of the day, that's what matters. Patient care is first, but you also need to stick to what you choose, and also involve, if you can get the opportunity to do more, or maybe if the opportunity for you to learn more comes at your door, and maybe comes, just take it, because at the end of the day, that's what really matters, because you actually get the clinical experience to see the patient care side involved and maybe related, and then you also get the clinical experience to actually learn from the practitioner that you're with. So I think it's really important for you to learn and ask questions when you don't really know what you're doing, or maybe you don't really know what the provider is doing. And based on my experiences, they'll be pretty happy to actually answer your questions. So ask questions, but do ask good questions. Don't just ask questions just because you want to show off that you're smart, but just ask questions just because you're genuinely interested into what A or B physician maybe on an NP is doing, and you really want to know more about it. So that was pretty much me talking about the kind of curriculum activities that you can actually get into. Do they even say curriculum activities? It's just extracurricular activities. There you go. So that was pretty much me talking about the extracurricular activities that you can actually get yourself into in order to get your clinical experience. And personally, I choose to become a medical scribe because of the options and the opportunities, which is pretty much the same thing that being a medical scribe gives me right now, which is a flexible schedule and kind of like a really close relationship with the physician that I'm working with, because we do have a lot of patients, so we do talk a lot about some condition that I've never seen before, of course, because I'm learning, and it's pretty happy to teach me about them. So I will see you guys tomorrow in another video, and just stay safe, pay attention to what you're choosing, because you need to stick to it at the end of the day, and forget that the most important thing is patient care, and see how A or B is doing, or A or B definition of patient care, so that you can actually get to know yours, because it's really important. So that was pretty much it for today's video. So I will see you guys tomorrow on another one, and bye. I'll cut it out right now.